You and so all right. I'm having a little trouble. Normally the start webinar button is like just hitting me in the face here. How do I start the webinar? And
Are you able to do it now that I'm host?
oh, you tell me. Do you see a start webinar button?
Um, Show webinar. Maybe I already started it.
Well,
It
that's
may
interesting.
it may have already started. I did
Well,
hit a start button.
I'm sorry, say that one more time.
I did hit a start button earlier.
That is hilarious, but I love it. Totally, totally
Can you
fine.
go in there and
I think
cut?
you did. Yeah, yeah. It can all be edited and whatnot. That's great. Well, let me welcome folks, everyone, as we are about to get started here. I see we have some attendees. I'm going to put into the chat, giving everybody a chance, the opportunity to chat as they desire. And I will welcome folks. Yep, yep. Cindy, I'm glad that you're with us. Panelists can chat with everyone, and attendees can also chat with everyone. Okay. Well, I'm excited that what we're doing here today. I'm excited that we have people tuning in. We are recording today's program to be shared with others. And I want to welcome everyone to today's lecture entitled Supporting Veteran Caregivers in Virginia, hosted by AARP Virginia. I'm Brian Jacks, Associate State Director of AARP Virginia, and we're glad that you will be joining us today to focus on this informative topic. AARP's mission is to empower people to choose how they live as they age by enhancing the quality of life for all as they age. How do we enhance the quality of life? Well, we do it through advocacy, information, and service. AARP Virginia creates experiences with your community in mind. We're neighbors, connecting you to free events, learning opportunities, and resources right in your backyard. Wherever you live, we're here to help your money, health, and happiness live as long as you do. I'm very excited to share with you our presenter for today. She's a personal friend and lives near me in the Roanoke, Virginia area. Cindy Markham joined Virginia Navigator in January of 2019 as the community specialist for Southwest Virginia, covering Allegheny, Bath, New River Valley, Roanoke, and surrounding counties. Cindy brings over 20 years of experience in sales, marketing, and operations from the healthcare industry. She has worked in long-term care, hospice, assisted living, long-term acute care, and caregiving. She graduated with honors from Bluefield College with a bachelor's in organizational management and holds an associate degree in mental health from Virginia Western Community College. Cindy is responsible for nearly 60 Navigator centers and one local government partnership. I'm thankful that Cindy's with us here today because she knows the ins and outs of caregivers, not just in the greater Roanoke area, but throughout the state of Virginia. She's working with an organization that AARP Virginia teams up with on a regular basis. And I'm thankful that she's here today to show us the wide variety, the array of resources offered by Virginia Navigator, and today with a special focus on resources for veterans. Welcome, Cindy.
Thank you for having me, Brian. I'm excited to be here and Are we ready to get started?
I believe so. I'll let everyone know that Cindy is open to hearing your questions. You can drop those in the chat or feel free to put them in the Q&A section at the bottom of your screen. I'll likely save most of those till the end of the presentation today, but if it's especially pertinent, I might interrupt and ask Cindy a direct question. I'll also be posting a few of the key data points that AARP Virginia just received as part of our study around caregiving prevalence in Virginia. If you would allow me to, I'll just share a couple of the key top line data points that were provided by that study, which released last week. One of those is that 80% of caregivers pay out of their own pockets to meet the needs of loved ones, and that averages at $7,200 each year, or around 25% of their income. Across the United States, many caregivers face financial setbacks, they take on debt, they drain savings, and in many cases are struggling to afford basics like food and medicine. And we recognize that the demand for care is expected to rise sharply as the population ages. Again, we are going to be talking about caregiving in general, as well as caregiving specifically for veterans and military families. Cindy Markham is a great resource for us. I won't go more into that data right now, but I will put some things into the chat and possibly bring it up for discussion as we proceed through today's 45 minutes to 60-minute session. Cindy, thanks for being with us today, and we look forward to your presentation.
Thank you, Brian. The data that you just shared, I can definitely relate to some of those challenges from caregivers. And before I talk about the wonderful website, Virginia Navigator, I want to share just a little bit about my caregiving experience. I've had quite a bit in the past 20 years. So I'll start off with my son. Well, there it is. So this is my one and only son, Ryan. He is
And
now
Cindy, I hate to
17 years old.
interrupt, but I want to let you know that we're not yet seeing a picture or a slide.
Oh,
Your
okay.
son.
Oh, let's see. It says that I am sharing.
All right. I know in the practice session that everything worked smoothly and all.
Yeah,
Is there a way to perhaps drop out and then pop back, like stop sharing and then go back to sharing?
yeah, yeah, we can do that.
Great.
Let's try that.
And while you're doing that, I'm thankful that we have folks from, oh, I actually just saw from the participants that in the chat that the photo did pop up for them. So let's try it one more time. Oh, it's working for me as well now. So
Okay.
I
All
think
right.
that, and
I may have gotten a little locked up there for a minute. Can you
oh,
see it
yeah,
now?
oh, definitely. We can see that. It looks like it's an intensive care unit. Doing it.
Yes. So my son Ryan, he was born 17 years ago at Carillion Roanoke Memorial, and he was transferred to Brenner's Children's Hospital in Winston-Salem, and that's where we lived the first several weeks of his life. He had surgery at 3 days old. He was born with a rare birth defect called bladder exstrophy, and his bladder was on the outside of the body. And so they had to break his pelvic bones and put the bladder in and move ureters around. So it was quite an experience being a first time mom. This was us going home at 5 weeks. I think he was about 5 weeks old then. We could not even take him in a regular car seat. We were in what was called a bed seat, a bed car seat. And I share that with you because then in 2012, we started going to Johns Hopkins, and that was when we found our community and support. So the first 4 years of his life, several years of his life, I felt very alone as a caregiver for my son with this very rare birth defect. Just didn't know, where life was going to go for him, for us. And going to Johns Hopkins was such a blessing to our family because that's where we found the community and support. They have a doctor there, Dr. Gearhart. You can see my son in one of the pictures with him, where he has been the world leading expert in this birth defect. And um, they have bladder extra picnics every year for these families and just educational events. They have a Facebook page that has just bladder extra parents and bladder extrophy patients on there that we can lean into each other. The picture of the two boys, that's my son that was in the hospital bed a few years ago. He had another surgery, and another little gentleman that is about the same age as Ryan. He lives in the Baltimore area, so he and his family came to visit us. So just a lot of community and support there. And this is life today. You wouldn't know that my son had gone through all of those surgeries. He's grown up to be a fine gentleman. I've also caregived for my dad, who had a lot of different challenges with his health. My father-in-law is the gentleman in the middle there. He was a veteran, and I would take him to his appointments at the VA, and they gave great care at the Salem VA for him. He's since passed away, and my dad passed away. My mother-in-law, there's her and I. I took her for a milkshake after a dental appointment. We skipped lunch that day. We just had milkshakes, and that's okay when you're 90 years old. So, yeah. And I tell you all of that because I share that because I want you as caregivers to know that you're not alone. I don't ever want you to feel alone in this journey like I did the first several years of my son's life. There is so much information out there. You just have to be able to find it, and groups and support. And that's why Brian asked me to talk today about Virginia Navigator's website, because we are a family of websites that just connect people with the different resources across the state of Virginia. We have the Virginia Navigator, we have the Senior Navigator, Veterans Navigator, and Disability Navigator. So when you need help, where do you start? Say you end up in the hospital, or your loved one ends up in the hospital, and you're needing to find care for that person. You need equipment when you take them home. You need to maybe have some in-home care. At Virginia Navigator, we consider ourselves like a little one-stop shop for that. You can search by city and county throughout all of our websites. So we recently did an update. It's probably been over a year now, but we have enhanced search features, live chat, text support, which it says on there coming soon, but we do have that now. You can connect to referral sources directly. Just a new look and a new feel. Why use Virginia Navigator? We're just a small nonprofit organization, and our mission is to serve Virginians. Simple, all the services you want and need in one place, and secure. We're not going to store or sell your information. I always tell folks, when you are looking for information, say you're in the market for a new coffee pot and you Google coffee pots, And then you get on your social media page, and all these coffee pots are showing up, and you're like, oh my gosh, they're watching me. Yes, they are. So at Virginia Navigator, we do not store or sell your information. Now, we do have a lot of links on our websites. If you click on links that go to another website, I can't voice for those websites, but we do not store or sell your information. We have over 26,000 resources that are searchable by city or county, and we're constantly reviewing those and updating those.
If
So,
I
as
could
I
just
said, yes,
just
Brian.
jump in, I always am attempting to just make sure that key points are being accentuated. 26,000
Yes,
components of helps for individuals, whether veterans, whether disability is a factor, or whether it's a family caregiver or a friend, right? And I'm just so thankful that Virginia Navigator offers. I know you're going to get into the specifics of what types of helps, but again, just recognizing that different people have different needs, and therefore it needs to be a diversity of needs and an array of different materials, educational, whether video or printed. I know you're going to get into it, but I just want to draw attention again to that 26,000
yes,
components of help that are a part of the family.
yes. Thank you, Brian. Yeah, so if you go to virginianavigator.org, and this is what's going to pop up on your screen, you're going to have the little widget with the little circle there that you can search. You can just put in a keyword or name, and you can search by city or county. That second box is always a drop down box where you can, it shows all the cities and counties in the state of Virginia. Or if you know that you want to search for a veteran, down here, the big circle, we've got the Veterans Navigator. There's different access points where you can get to these different websites. And so Veterans Navigator, seniors, if you're looking for aging or caregiving information, you can go on the Senior Navigator page and website and find all kinds of great information. The Disability Navigator website. Or you can also, up top here, there is a drop down box with the different websites as well. So when you go to the disabilitynavigator.org website, this is what you're going to see. And you're going to notice that all of our websites have a same similar feel and look to them. And a lot of the information is, it crosses each website. On the Disability Navigator website, you're going to find information for advocacy, health, transportation, community, home, family, and planning. The veteransnavigator.org website, there you're going to find information about benefits, health, transportation, community, housing, employment, quality of life, just an array of information there. The Senior Navigator website, you can see up top there the big red arrow. There's where your little widget is, where you can do your search again for if you put in a keyword or name, and then that drop down box with the cities and counties. Each of our websites is going to have these editor picks. These are different articles that come out. These come out, we change them every month. And just depending on the season, this particular one, dealing with grief during the holiday season, caregiving and aging well, our magazine, Social Security benefits. And then on the Senior Navigator website, you're going to find information on aging well, financial, transportation, caregiving, housing, community, legal. And that's where you're going to find articles, books, guides, links, apps, and videos on each of those websites. We also have some technology on staying connected. Down at the bottom, you're going to scroll all the way down. We can't put it all on the page here, but when you scroll all the way down, you're going to find these Ask an Expert, the Caregiver Tech Tool, a place you can sign up for our newsletter and view upcoming events in our calendar. So the Caregiver Tech Tool Finder recommends apps and devices to help you care for yourself and others. So it's going to have a drop-down box, and you can find information, apps, and devices for Alzheimer's and dementia, caregiver health and self-care, daily caregiving resources, family coordination, healthy aging, medication management, remote monitoring, companion technology, smart home devices, social connectedness, and wearable personal technology. You can sign up for our newsletter article. There you have different options. We have e-quick tips that comes out once a month. We have a navigator newsletter and a caregiving newsletter as well. So you can sign up for those and they'll come straight to your email. So I'm going to show you how to do a search, and I am doing this from the seniornavigator.org page website, but you can actually do this from any of our websites. And in this particular one, I'm searching for a caregiver support group in Charlottesville City. You hit the search button. It's going to pull up a comprehensive page or a page here that's going to show all the different caregiver support groups. And as you can see, we can't see all of them, but it says 74 results there at that second box. So there was 74 results for caregiver support groups in that particular area. You can also narrow your search over to the left there by adult daycare centers. It looks like there's 3 of those, Alzheimer's and dementia 33, only caregiver support groups would be 18, wellness and alternative 20. There's the direct connect partners. Those are the ones that you can connect with directly from our website. You can search local, statewide, and nationwide. You can search by cost. And then over to the far left, you're always going to see your local area on aging's information from that particular area. And I hope everyone knows who their local area on aging is in whatever area that you live in. If not, please put comment in the box, in our chat box, so that we can get that information to you.
I'll also post a web link to Virginia's statewide Find Your Area Agency on Aging
Yes.
page so that folks can know, looking by county, to find where that they would fall in. I noticed that we have people from Virginia Beach and other areas of the state.
Perfect.
I'll put that in next. Thank you, Cindy. You're right. That's an
Great.
incredible resource that everyone needs to be aware of.
Yes. And each local on area on aging, they each provide different services. So what is provided here in the Roanoke area is different from what might be provided in your area. But I really highly recommend you getting to know them and what services they can help you with. So once you find one of these caregiver support groups that you want to know more about, you can click on it and it's going to pull up this comprehensive page that's going to show all the information that you need to contact them. You can call them, email them, it's going to have the name, address, phone, email, notes, who they are, what service area they cover. And a lot of times it'll have cost. We do highly show on our website those services that are free. You can actually search for free services. So when you are on the Senior Navigator website and you scroll down to about the middle of the page, this is where you're going to find all these resources, the books, guides, links, apps, and videos. Same if you're on the Veterans Navigator website or the Disability Navigator website, you're going to find all these different topics. We're going to stick with the Senior Navigator website, and I want to share with you a couple of these tabs. One is the Aging Well. You just click on it, and as you can see how robust it is, it's got you're going to click on all of these other options here, just depending on what you're wanting to know more about. The Aging Well topics is healthcare settings and providers, mind and body, healthy living and prevention, medical concerns. Lots of great articles, even more for you down at the bottom, and you're going to see more of that as we go along. So next, I want to talk about the caregiving. And the caregiving tab is only in the Senior Navigator website. So you can go there and search for just services, caregiving services. Caregiver, there's a little widget there, searching caregiver services with all these different topics: Alzheimer's and dementia, assistive technology, care coordination, caregiver education, caregiver support and respite. Just lots of opportunities there, different services to search for. I'm gonna pull up the caregiver support and respite. And in my second box here, remember that's always a drop down box with all the cities and counties. In this particular one, it shows Montgomery County. Again, it's going to pull up all the search results. This particular one shows 29 results, and you can narrow it down. You can click on one of those and it'll pull up that comprehensive page. Again, it's got your local area on aging's information there. And if you scroll on down past that caregiver tab, you're going to find information down at the bottom that says more for you. There you can find our Veterans Caregiver Resource page. And we want to highlight the AARP celebrates family caregivers and AARP family caregiving resources for Virginia. So this is the Veterans Caregiver Resource page. When you click on that, that's going to give you all these key articles, tools, and resources, staying connected, your local veteran programs. So you can click on those and find all kinds of great information for veterans. And then the AARP caregiver programs and resources. The programs that allows you to connect with AARP's upcoming programs. Like if you would have went in there today, you could actually see and link into this webinar that we're doing. Some are Zoom and some are in person, different events. And I'm sure Brian can highlight that a little more than I can. But then the AARP Family Caregiver Resources for Virginia tab there, you can find links to caregiver support, finances, legal, health, housing, care facilities, your local area on aging, and end of life care for veterans.
And I just wanted to mention that I've dropped into the webinar chat box a link to the AARP Veterans Focused page as well. And you're right that it is the page that I've dropped in showcases a variety of resources for veterans. Not all of them are exclusive to caregiving, but know that that is one of AARP's top priorities to support veterans and military families, whether they're in the caregiving role or not. So thanks for including us in the presentation today.
Absolutely. So we also have a dedicated caregiver resource section. As you can see, the little hand up there on the left for caregivers. And if you click on that, you can create a user account and sign up for our newsletter article there, get to our caregiver tech tool. We have the Ask an Expert feature. And I didn't talk about that earlier, but let me just mention the Ask an Expert feature is a wonderful feature. If, say, that you are doing your taxes and you have a question about that, you can submit. You do have to have an account, so you have to create an account with us, but you can submit your question to Virginia Navigator. All of it's confidential. We get with those experts, whether it be a physician, an attorney, or a tax accountant. We get with that expert, find the information that you're looking for, and email you back. So it's a wonderful free resource to sign up for. So some other resources in that middle of the Senior Navigator website is community. And I want to highlight that because we have the social engagement tools and resources, and how much we know now about being isolated from people and the damage that that can cause to us mentally and physically. So we have the social engagement tools and resources where you can connect with different opportunities within your communities. There's the Virginia Easy Access Engagement Finder. There's the Caregiver Tech Tool, of course, and then um, there's social assessments to see uh, how how isolation affects you. So lots of good information there. And then down at that bottom of that page, we also have the Virginia Long-Term Services Finder. So we have a widget. You click on that and you've got this widget here. And that has a drop-down box with finding the different levels of care that you might need, whether that be adult daycare, assistant living, home health, hospice, CCRC, life plan communities, memory care, nursing facilities. And again, that second box where it says select an area, that's always going to be a drop down box with all the cities and counties in the state of Virginia.
I like the fact that everything on this site is so searchable and that you're getting information that you know pertains to where you live.
Yes.
And that can be helpful both if you live in the same geographic area as the one that you care for, or if you're needing helps in a geographic area because you live 3 or 4 states away. And I'm thankful that this resource, Virginia Navigator tool, enables families to look things up without having to spend 2 days driving across the community on perhaps what's a short visit to help care for someone in need, and that a lot of homework can be done ahead of time. And then you can say, hey, mom or grandma, I'd like to visit the daycare center when we're together, or I'd like to check out this caregiving support group when I'm in town. And you've got everything in a way listed out, planned in advance to enable to use that time most wisely when you're together with your loved one. So I just am so thankful for the way this has all been set up and for the fact that those search tools allow you to really drill down to what it is that I'm looking for. And then also to clearly defined geographic boundary in which to look.
Absolutely. So I do want to share one more of those little tabs with you is the transportation, because we know um, transportation can always be a challenge, especially in the smaller rural areas when you're caring for someone and or if you know are an elderly person living on your own. So we have connected with the Virginia Department of Rail and Transportation and came up with a widget. There's also articles there. There's tons of great articles in the Explore Transportation topics, but in the middle there we have that widget where the red arrow is, and the Virginia Transportation Finder. You can select a topic, and they do have veteran transportation is an option. Commuting and ride sharing, inner city transportation, non-emergency medical, opioid and substance use transportation, the veteran transportation, public transportation, ride app services, taxis. Again, that second box is going to be a drop-down box that you can search in your city or county. So, moving on, you can do all of this. You can do searches for services from your mobile phone. And then we also have what's called navigator centers. So, when Virginia Navigator started 20 plus years ago, we started at a time where, internet was not as popular as it is now, and especially in rural areas. And we started off as senior navigator. We added disability navigator, and then veterans navigator was just added in 2016. So um, we had some challenges on how are we going to get this information to people that didn't have computers or they didn't have internet. So we kind of partnered up with different organizations, adult communities, area on aging, faith-based ministries, hospitals, meal sites, libraries, senior centers, sheriff's departments, transit companies, and we partnered up with them and said, hey, you have a computer and you have internet. Can we partner with you? Will you become a navigator center so people in your community can come to you and use a computer and or you help them find the services that they're looking for. So that's we have over 700 navigator centers across the state of Virginia that helps folks find information off of the Virginia Navigator website. And then we also, I want to share, have a toll-free number. It's 866-393-0957. I don't promote Virginia Navigator as a call center because we are absolutely not a 24/7 call center. But if you call during regular business hours, non-federal holidays, you can get a live person at our office that will also help you find what you're looking for. Our website is so robust. It has so much information on there. Sometimes you just can't find that right word to type in to do the search. And if you call one of our folks at Virginia Navigator, the 866 number, they will be able, they work it every day. They'll be able to help find that for you. So do we have any questions and any feedback?
Thank you for asking, and I'll take a look at what we have here. I
Yeah.
see him just putting into the chat that Virginia offers a helpline to all residents at 211.
Yes.
Will direct callers, sorry, I'm typing it as I speak here, will direct callers to assistance. Really, that's of all kind. I'm putting it in the chat so that it will be included when individuals receive a recording, and even those who registered for today's event but were not able to participate during this time. So there is a question about if you could elaborate on the Navigator Centers. Um, I don't know exactly if that's in reference to the by phone. Ramona, because I'm aware that you can probably ask this better, I'm going to hit allow to talk. And if you'd be willing to put forward that question, Ramona is one of our AARP volunteers
Okay.
who's listening in and actually writing up a follow-up story. Ramona, can you ask your question a little more clearly so that Cindy can answer?
Yes, thank you, Brian. You indicated, Ms. Markham, that there are navigator centers, there are over 700, but it wasn't really clear to me exactly what services are available at the navigator centers. Is it just that you go there and use their computers, or you go there and someone helps you to use the computers? I just wanted a little more information, since there are so many, regarding what exactly they provide. Thank you.
Yeah, absolutely. So it's really going to depend on what type of navigator center you go to. If you go to a library, of course, they have, and over 50% of our navigator centers are libraries. And that's a place where you can go and, if the librarian is not busy, a lot of times they will sit down with you and help you do a search on a website. If you are inquiring at a police department, that is one of our navigator centers. A lot of those navigator centers that they are not directly working with folks at their facility. They may be out in the community and somebody asks them a question and they help them navigate it that way. Um, just making their communities aware of the Virginia Navigator website and where they can find those resources. Does that make sense?
Ramona, I think that's probably what you're looking for, and you're on mute, but I'll say this, and that is that I've also noticed that some of the area agencies on aging serve as centers and oftentimes are pointing people on, okay, here's a way that you can search a little more cleanly or a little more clearly on a topic like transportation or, um, again, personal health, caregiving resources. Um, Ramona, I saw that you came off of uh, mute, and I don't mean to overrun you with my conversation. Did
No,
that
I
give
was
you a
just
clear answer?
saying, yes, that clarified it. Thank you. But I think I didn't quite get on as quickly as I wanted to on unmuting. But thank you.
You're welcome.
Thank you. One of the questions that I have, and I hate to put you on the spot, but I think that you have some resources in reference to senior hunger. Is there something, obviously that's kind of been in the news of late, but is there anything that in reference to food support for caregivers or families that are caring for loved ones?
So we used to have all the food banks on our website at one point, and it became very overwhelming to keep up with because they moved so frequently. So now there is just a link to the, uh,
I think it's the Federation of Virginia Food Banks
yeah,
that then allows Feeding America and others to be clearly outlined there. I know that the Federation offers a mapping tool similar to what you've shown in some other areas and resources, where you can search by your zip code and see not only the food banks, but all of the many, many, many food pantries, which are
yes,
the ones that are most likely to shift from one location to another or pop up when a need arises. Whereas the food banks, I believe there are 12 or 13 of them in Virginia right now that are pretty much the standalone concrete ongoing, for decades, but they in turn support the food pantries that exist throughout the communities. And yes, that would be a lot to stay on top of.
yeah, yeah. And I run into many times if folks are looking for that type service, they can only go one time a month. Is that right?
I know that different food pantries have different rules, even different food banks
Yeah.
have different expectations. And a lot of it depends upon what age individuals are in your home. So I don't think that there's any real true rule. I was just at
Right.
an event in Bedford County where a brand new food pantry has begun at a church in Forest, and they were very clear. Anyone is welcome. Come during the time frame that we have listed, which is Wednesday over lunchtime, or make an appointment, and we will do what we can to help you out. Very limited stipulations or questions asked. So I know that
Yeah.
there are many organizations attempting to help individuals in need, and I'm thankful that I know for a fact that Virginia Navigator has done so in the past, and even in reference to Meals on Wheels and the fact that some of the area agencies on aging run the Meals on Wheels programs and are featured on your pages. At other times, it's a standalone nonprofit run by a separate board of directors and overseeing those types of meal delivery in communities, both in urban and rural settings. That is quite a challenge.
Yeah, and I think you're pointing out on something, Brian, is the importance of knowing your community and what resources is there, because knowing your local area on aging and what they can help you with, knowing what churches are out there that do allow folks to come once a week or ever when they're open,
Yeah.
just knowing those resources and knowing your community is very important.
Well, and I want to just piggyback on what you've shared, and that is recognition for everyone that's listening to this webinar or tuning in down the road, a recognition that we can't know all of the resources, even in communities in which we've grown up and lived in for decades. And so that's why I'm so thankful that Virginia Navigator has served as a gathering spot to say, don't feel badly that you don't know of all the resources that are out there, and that those in your network of associates and community are unaware of certain things because they haven't had to take part in them or haven't needed those types of resources in the past. Instead, come to the site, put in your information, and we will help run through the data and find what options could be best for you. And then you're putting that information into the hands of the consumer who says, this one would work for me in my situation. This would work better for someone else. And especially, again, that focus today on the fact that at times veterans have different needs or qualify for different benefits that not everyone does, as a recognition and thanks for the service that they've provided.
Yes. Thank you.
I'd like to just wrap up with the point that you began with, and that is the sense of community is important, a sense of gathering, a sense of social connection, how many of these things are linked. If you're not able to be out socially engaged and interacting with others, that has a drastic negative impact on brain health. Brain health declines, mental or physical health can also take a toll. And I am thankful that I'm going to give you a chance to give anything that you'd like to finish up on that community aspect. But I want to point out the fact that several of the resources that you offer are for the caregiver in the terms of support groups that meet regularly, information that could be helpful, make their job easier. On Thursday night, we're hosting a caregivers retreat where we're going to have a presenter on the use of technology and how technology tools and tips and hacks, if you will, can assist caregivers on the stress level and energy and being mindful and being aware of what's taking place perhaps in another state without you having to be there. So caring for the caregiver, whereas many of the resources are focusing on helps for the person being cared for instance, meal delivery or transportation, as you pointed out, for veterans or for others. But if you could just wrap us up, being that I believe we've answered all the questions, with that sense of the importance of community. And I think that's a good way to close things out, recognizing that we all need each other. And I'm thankful for those who were able to participate in the call today.
Well, I definitely can't wrap it up any better than what Rosalind Carter said, that there are only four kinds of people in the world: those who have been caregivers, those who are caregivers, those who will be caregivers, and those who will need caregivers. And knowing that, and knowing your community and finding your people is so important in whatever season of life that you're in.
Very much agreed. Cindy, thanks for walking through the resources and tools that Virginia Navigator offers. Thanks for giving of your time today. It's always a delight to be working alongside of you and appreciate the dedication that you've shown. And I want to thank everyone here, whether an AARP member or the general public. Please know that you will receive a recording of this program, which can be shared with others. It will also be featured on the AARP Virginia YouTube site, which receives many, many hits and visits each month. And if there are ways that AARP Virginia can assist you further, whether on the topic of caregiving or fraud or brain health or other issues, please don't hesitate to reach out to us as well. We'll have that information as we follow up from this webinar, as we do on each and every one. Thanks for being with us today, and I wish you the very best.